Welcome to the Northeast Kingdom Voice. I'm your host, Scott Wheeler. Today's guest is actually a returning guest. It's Dr. Don Harris, and he is a chiropractor and a nutritionalist. And he's here today to talk about what he does and about his new office. Welcome to the show.
Thank you, Scott. It's great to be back. Yeah, it's last time we talked, it was probably about a year ago.
Right.
I think, and things have been absolutely wonderful here. People have treated me with great respect. The office has been going great, and I think last time we were here, we talked about maybe the issues of trying to combine alternative healthcare into mainstream healthcare, and there was a little bit of a disconnect in there. And in the past year, that has changed dramatically. Both the alternative healthcare providers and the traditional healthcare providers, I think, have come together a lot more than when I first started here.
Right.
So it's actually a pleasure to work with the healthcare providers, the MDs and the hospitals and things, because I think they accept the alternative aspects a lot more than they used to. So,
do you think part of that too is because, you know, this country, but particularly the Northeast Kingdom, we do have a doctor shortage of primary care doctors.
Absolutely.
Do you think some people are now just saying, hey, you know, let's try this route?
You know, it's amazing. When I first came to Vermont in the Northeast Kingdom, it would always amaze me that when people would get sick or have an injury, if their finger was even 10% attached, if they had a farm accident, they would say just wrap it and go back to work. Whereas in Chicago, if people woke up with a slight cold, they would be at the doctor's that afternoon. So people here are much more willing to take care of themselves and not go to a doctor unless they have to, or an MD. And I think that correlates back into years. I think people are much more open to seeking alternative forms of healthcare than just the traditional, without a doubt.
Well, you know, I think part of that is we're also closer to the land and closer to more traditional ways of, like, home remedies.
Absolutely.
This may not have been a home remedy, but Vicks Vapor Rub in my family would have cured everything.
Oh yeah, it's still used. People still come in,
but and
they ask me about it.
Right, and do you know though, this is a strange thing, but it sounds like a stinky cure, but I guess it isn't. Is skunk oil? I've interviewed in my other world as a Northland Journal. I've interviewed many people who, in past generations, that's what they used to rub on them. It was, and you think, well, that's odor. No, I guess it actually didn't stink. So, you know, then you've always heard, you know, the stories of the castor oil and so on. So I think maybe we're just we're closer to that period of time where you kind of did care for yourself.
Yeah, and absolutely, and aromatics have a big role in healthcare today. And if you look at supplements or vitamins or herbs, the more they have an aromatic sense to them, the more powerful they are. So when you get a bottle of something over the counter and it doesn't really have any type of aroma to it, it's probably not going to help you that much. So, like, one of the things that's being investigated now heavily is turmeric or curcumin. If you ever baked with curcumin or turmeric, you know it smells. But I think it's MD Anderson down in Texas is doing tremendous work with turmeric and curcumin, which is an herb, for anti-inflammatory purposes in cancer. But of course, it has to have the whole aromatic compound to it, or it's not going to do you any good. And a lot of people come in and they say, well, I just need a little bit of turmeric on my food, and that'll do the same thing. And yes and no, you have to have a little bit more of a concentrated form. But getting back to the land, getting back to the original herbs of this area, chaga mushrooms, which grow naturally in this area, is a phenomenal anti-inflammatory mushroom. Now, I'm not saying for people to go out there and go hunting mushrooms, because it can be dangerous, obviously. But if you know what you're doing, chaga mushrooms is a great medicinal mushroom that's found in this area that has incredible anti-inflammatory and antioxidant properties. So yes, there's a lot of things that people can do just by going into their backyards. Dandelions. We're looking at more and more issues with dandelions now, and how that's very anti-inflammatory and antioxidant. And a lot of researchers are doing it now, or researching it as it relates to cancer. So yes, just going in your backyard, going into the wood, you can find a lot of things that can be very, very beneficial for a wide variety of illnesses.
Well, I believe it's mullein and plantain, and I'm not sure if it's vinegar mixed together is supposed to be work well for sunburn. So, and those are all things that are right here. Well, there's a belief, and I'm not sure if it's true. Is so there's a plant that cures every ill. That we come up with. You just don't know what
it is yet, right?
What it is.
Yeah, there's an old saying, and I'm gonna misquote it. I know I'm going to misquote it, but it's something to the effect that God doesn't give you a disease that He doesn't create the package for. The cure for. So for every disease we have, there's a cure out there for it. And sometimes it's pharmaceutical. And again, I kind of try to stay in the middle of the road. I try not to go too far to the alternative, and I try not to go too far to the traditional medicine.
Right.
So there's a lot of things that, like I said, in the middle of the road that can actually have a very beneficial effect. Right. So.
Talking about pharmaceuticals, this is probably a little off the topic, but I couldn't help but bring it up now that you mentioned it, is I recently had a guest on my show, and actually it was 3 guests. It was a recovering heroin addict and her former probation officer and our state's attorney, and it was interesting listening to her talking about pharmaceuticals in the sense of the illegal use of painkillers and such. Do you, in your world, do you see much of that?
Abuse?
Yes.
Unfortunately, yes. And if you read the statistics in northern Vermont, it's one of the highest areas in Vermont and in the country of prescription drug abuse. And when I moved to Vermont, I never would have thought that. You think Vermont is very clean and health conscious, and it is. There's no doubt about that. But the abuse of prescription medication in northern Vermont, as well as throughout the country, is at epidemic proportions. And yes, unfortunately, I do have a lot of people who come in and they tell me what they're taking for their pain, and I just kind of have to shake my head and just go, wow.
Unfortunately, a lot of it's being prescribed, prescribed to them, but then if you're not abusing it, you might be selling it to somebody else who wants to abuse it.
Right, and that's the other problem. Is I think they just arrested a couple of people trafficking a lot of the illicit drugs up from New York, and heroin and different things like that. So Vermont has its own problems with abuse of pharmaceuticals. Now, with that being said, do I believe in pharmaceuticals? Absolutely. Hey, I'm a perfect example. I take pharmaceuticals from my MD, and they're absolutely wonderful. But I think you can combine that with some other things, some natural remedies that can work along with that, or in conjunction with the pharmaceuticals. So I think pharmaceuticals are an absolute necessity in our country. Maybe they shouldn't be the first choice every single time for someone. Maybe instead of giving someone a narcotic that's pretty addictive, maybe there's other things that you can do, like white willow bark or some other things that have pain relieving qualities also. And if that doesn't work, then maybe you can switch to a pharmaceutical. But there's always choices. Right.
Now, I've been interviewing, I've been doing a series on Dr. Frank Fioramonti.
I read that in your last journal.
And Dr. Fioramonti is a doctor from the old school, the 1940s he began. And he said was some things too, like whether it's anxiety, whether it's high blood pressure, high cholesterol, is sometimes just listening to the patient, and then you realize, oh, okay, they have high blood pressure, high cholesterol, but it's not urgent at that time. Sometimes it's just a lifestyle change, a diet change. And he said, but while he said now a lot of doctors, because of the way health care is often administered, the doctors are so pressed to get that patient in and out because
Right.
of the insurance companies, the
They have
hospital.
15 minutes.
Right, and that it's easier to throw a pill at them.
Right.
And that's how come he said he would hate to practice medicine today because of what the doctors face with
Right.
these time limits. When a patient, if I go to you, are you going to kick me out in 15 minutes? I can't say hello in 15 minutes.
I'm a little bit different than most healthcare providers. My average office visit is about 45 minutes to an hour.
Right.
And I do that on purpose. I've always done that. I think you have to get to know the person or the patient, you know, as a person. You have to spend time with them, and by listening, you can get so much information from patients. So no, I spend a fair amount of time. But getting back to the anxiety part of it, and you're right. A patient may go to a doctor and complaining of anxiety, and the first thing, and not the doctor's fault, you know, they'll give them some type of anti-anxiety medication because it's the easiest thing to do in the 15 minutes that they have. I have people who come to my office who don't want the pharmaceutical drugs, and I give them a combination of inositol and GABA, which are neurobrain transmitters, and I have pretty good results with that. For moderate to mild anxiety, anything that's more than that, it probably won't work. But again, you have to talk to the patient. You have to get to know them. Will this work for them? And unfortunately, you're right, with the insurances and the pressures they put on the MDs to get something done in 15 minutes, they're just not going to be able to figure out what natural alternatives would be appropriate for that patient.
Right. You know, I have been fortunate because I go to Dr. Robert Wood, and he doesn't practice under any institution. He's affiliated with the hospital, and his appointments are like yours. And as he said, he was born a generation too late. But unfortunately, I'm already mortified. He's retiring in August of next year.
Wow.
And it's like, and he has such a loyal following. But then again, we do have a mutual friend, Dr. Les Lockridge, who is also an independent doctor.
Right, and actually, Les takes a lot of time with his patients.
Right.
It's not just a kind of a 15-minute wham bam. And I mean, he sits down and he listens, and he takes more time with his patients. And there's other docs out there that spend time with their patients, and they're kind of bucking the system, you know, because again, insurance is, you know, you get paid on 15-minute intervals, and so they're under that constraint. But I know there are some other doctors, and Les is definitely one of those,
Right.
who truly cares
Yes.
for his patients and will take, you know, the time needed.
So I guess that's a good transition period because you also wanted to kind of thank the community because you're actually under the care of Dr. Lockridge now yourself, and you wanted to talk about that.
The community has been fantastic. I was diagnosed with leukemia about 4 years ago in Chicago, and I did 3 rounds of chemo that didn't really do that much. But I'll always say I'm the healthiest person with cancer because I don't have to fight diabetes or heart disease or obesity or anything like that. I exercise, I eat well. So, you know, even though I have cancer, I always say I'm the healthiest person with cancer. But August came around, and you know, things weren't going great. The blood work wasn't coming back great, and the symptoms that I was having. So I decided to close the office in August just to kind of see how a new chemo that Les put me on would work. And I also thought it was a good opportunity because I had outgrown my office space. Again, you know, I had done very well here, knock on wood. People had treated me very well. So I am under Les's care for leukemia. It's going to be a long-term chemo. I have every faith in the world in Les that it will, you know, the outcome will be positive. But at the same time, I do integrate what I know to be integrative in terms of what I need to do in my healthcare. Again, one of the things like turmeric, which is, you know, phenomenal in terms of anti cancer. I try to eat a low sugar diet. Try to eat high fiber, lots of vegetables, lots of the right types of fruit. Try to keep my stress levels down because virtually every study now is coming out that stress, not on a behavioral aspect, but on a physiological aspect causes lots of problems. And we know that high levels of stress can be related to cancer because it throws off the hormones in the body, which then can suppress the immune system, which then can lead to cancer. So when you look at cancer and you look at, say, someone like Les, who will do the pharmaceutical approach to it, there's many other approaches that you can do also. Like I said, diet, supplements, behavioral, exercise, stress are all really important aspects of dealing with cancer on an integrative approach. And I'm not saying one is better or worse than the other. And I'm not advocating anyone give up pharmaceutical or chemo to try something else. But I do think if people can combine and work with people who, like Les, who knows the pharmaceutical part of it and is very, very, very good at it, and someone who knows maybe something else, and working, the nutritional part of it, and a personal trainer. We have great personal trainers, in this area. So I think an integrative approach, I think, is a great approach. But as far as the people here, it's they have been absolutely phenomenal. I had to take 7 weeks off, while I started chemo, and I just opened up this past Monday at a new office right next to the wellness center.
That's such a great logical place.
It's an incredible place.
Yeah, and just for the viewers, the wellness center is on the I-91 access road to. Those of you who've been around here for 20 or 25 years, it also used to be the Prouty and Miller building.
That's right. That's how I explain it. Everyone goes, I give them the address. I'm like, where? But when I say the old Prouty Miller building, I go, oh, I know where that is. So
yeah, and realistically, it wasn't Prouty and Miller for that many years. It's just but you've been around here long enough. We often talk by landmarks that don't even exist anymore.
Yeah. Well, my old office. Well, this one still exists, but when I first opened up at my first office across. On Coventry Street, all I had to say was, across from the Pick and Shovel. Yeah. People knew exactly where the office was.
You're in the creamery too.
Exactly. The old Hood building.
Yeah, and then it was a dance hall.
I heard that. Someone told me that's what they used to hold dances there. Yeah.
Yeah. So when you get here, you have to quickly learn the history.
I'm learning, believe me. I thought I was a faster learner, but I guess as I'm aging, that's not quite as fast as when I was in my 20s. But I'm learning my way around here in the old landmarks and the history of this area, and this area is just rich in history.
You know what I have in talking to Sabile Anderson, who's a nurse, who's a midwife. She has found the same thing as you have about people embracing these, I don't know, I guess I would say new ideas, but they're actually old ideas.
Old ideas that are becoming new again.
Right.
Yeah.
And
what goes around comes around.
And she's also finding, particularly among the younger medical providers, they're much more embracing of these ideas.
Right, and because it's being taught now, and again, nothing against the people my generation of the MDs, but nutrition and alternative healthcare just wasn't taught in medical school. And when you ask them, it's like, well, how much did you get? How many hours did you have in medical school on nutrition? And most of them will say maybe an hour.
Right.
And it's not their fault. They were just never taught it. And so I think now things have definitely changed. People are being taught a lot more about nutrition and other alternative health care. Massage therapy, personal training, exercise, stress reduction. Again, like what we talked about, all goes into it. And even the nutritionists. It's interesting depending on what nutritionist that you can talk to. We can have different ideas about what's really healthy, and as we were talking about with Todd earlier, about BMI, and someone will go to a doctor and they'll say, well, I want to lose 30 or 40 pounds, and I think it's a great idea that they want to lose a little weight, and the doctor will say, well, that's great, and they'll maybe give them a little bit of a diet to follow. And there's a couple things I would question about that. Number one, in 30 years of practice, I found that if you just give someone a piece of paper and say, here, follow this diet for 30 days and come back and see me, it's probably going to fail because there's no accountability. If you give someone accountability that they're going to be responsible to you, it could be an office visit, it could be email, it could be Skyping, it could be many different things, but accountability is huge. And so if a doctor gives someone a piece of paper, there has to be some form of accountability. And I think that goes a long, long way. And then when we talk about, okay, I want to lose 30 or 40 pounds. 30 or 40 pounds of what? Okay, so someone comes in and they lost 25 pounds, on their goal to 40 pounds. Well, that 20 pounds could be basically water and muscle tissue, and that's not what you want to lose when you're losing weight. All right, because you're still maintaining your fat levels, and we all know that fat is highly inflammatory. It produces a lot of different toxins. As a matter of fact, a lot of toxins in your body are stored in fat cells because they're fat soluble. So you're losing all this water, you're losing all this muscle tissue, but you're maintaining your fat cells. And so you have all these toxins that are still in your body. You've lost 25 pounds, but your metabolism now has slowed down because it's the muscle that's metabolically active. And then people what do? They get off their diet, they've lost their weight, and what do? They put on the weight
Plus some.
Because their metabolism now is lower than when they started. So when you're following someone through weight loss, you have to follow them in terms of accountability, and you have to track what type of weight that they're losing. Are they losing water? Are they losing muscle tissue? Hopefully, the majority of that weight is actually fat tissue. And not only are they losing weight, it's a lot healthier. Because now you're maintaining muscle tissue, which is metabolically active. You're losing fat, which is inflammatory anyways. And, inflammation affects your immune system, affects your liver, and affects your brain chemistry. So, you want to do it the right way, not only in losing the right type of weight, but in terms of a healthy manner as far as how it affects the whole body. So it's hard, but that's the way weight loss should be done. And again, getting back to the MDs, they have their 15 minutes,
right?
And they're not going to be able to go through all of these parameters to check all these different things. So when people do decide that they want to lose some weight, they should really check out someone who kind of looks at all these different parameters and follows them through, and they're accountable to that person.
You must cringe when you hear some people or you see ads for these starvation diets.
Yeah, fasting,
because you can't. If you don't eat, you're going to lose some quick weight.
Absolutely.
But it's like, for example, in a previous chapter of my life, I'm a recovering junk food junkie. When I say recovering, the cookies no longer talk to me in the cookie aisle. But I used to eat quite bad, but now I eat very well. I mean, I think it's just the mortality thing. A few years ago, my wife and I just simply changed. Are we on a diet? Absolutely
You
not.
did a cold turkey.
Yeah, which
is great.
It's just I will treat myself, but I just don't. It's like, for example, if I have a half gallon of ice cream in the house, it has to be, and it cannot sit there. So I don't have ice cream in the house because it's gone.
It's called being proactive.
Right.
Because if you have ice cream or chips or trigger foods in the house, you're going to eat them. So the idea obviously is try to not have those in the house. You're absolutely right.
Now here I am with my cup of coffee. You don't even drink this.
I'm one of the rare ones.
I am. I don't know if somebody told me you're gonna knock off 5 years of your life by drinking coffee, I might say, well, I guess I'm going to stick with my coffee and hope for the best.
Coffee is one of those things, there's a couple of different things. Obviously, coffee or caffeine has been related recently to reduction in Parkinson's disease. So there's some benefits that are coming out of drinking coffee. But what caffeine also does is that it's a stimulant. So it overstimulates your body. It can actually increase cortisol levels in your body, and cortisol is a hormone that comes out of your adrenal gland. And have you ever been scared and you get that flush in your body? That's adrenaline, but cortisol levels go up too. Cortisol levels are highly inflammatory. Okay, so there's a lot of destruction when cortisol levels go up. Caffeine has a stimulant, and it will raise cortisol levels. It will affect your blood sugar. It affects your insulin levels. So when I work with people, I try to at least get them off of coffee for about a month. All right, if we can do it. If they're just not willing to give up their morning cup of coffee, then we'll work around that. But coffee is something that, again, it's kind of in that middle ground where some research is showing it's actually good for you, and some research is showing that
it's kind of like
it can't happen. It's like everything else. You're right. But but and again, I'm not saying people should never drink coffee again by any stretch of the imagination. But if we're starting someone on a weight loss program, I will ask them to forego coffee for a couple weeks just to see what their reactions are. So
there might be some divorces in there because some people get awful stressed without their coffee.
You're right, and and then the withdrawal symptoms of the headaches and everything else. Now, if they don't have a reaction to it, then yeah, they can go back to drinking their coffee. But it's something I like to do just at the beginning to see how they react to it. So
I've known a couple people who they loved their coffee, but they never put two and two together. Is they also developed this. They ended up at the hospital, the doctors a couple times for these racing heartbeats, and not, and they found out that they had a astute doctor who said, well, let's try taking you off of coffee. And some people, it's apparently their bodies or their hearts or whatever react to caffeine in a very negative way.
Right. It's more of an issue of how the caffeine is detoxified in the body. Everything that goes into our body goes through our liver to be detoxified and gotten rid of either through our urine or our sweat or our stool or our breath. So we have to take these toxins out of our body, so they go through the liver, and the liver is one of the organs that actually does that. There are some people that just don't have the enzymes to take caffeine apart, to detoxify it to a neutral state. So those people are going to be at much higher risk for caffeine overload or to have effects of caffeine because it stays in their system a lot longer. So if someone can detoxify caffeine very rapidly, they drink it within a half hour, 45 minutes, it's neutralized and gone. Other people, it could stay in there for hours. There's a test you can do actually to determine how your liver detoxifies coffee. So, I'm not saying that everyone needs to go out and do it because it costs money, and I think a lot of times these high-priced tests are just a waste of money. Right. Because it just puts much more of a burden on our healthcare system to pay, hundreds of thousands of dollars for all these tests. But before I forget, because I'm old, I'm going to forget this if I don't talk about it. We were talking about you being a junk food junkie, and I was the same way. I loved my hostesses and everything else. And there are several studies out now that show that the same pleasure part of the brain that is triggered by heroin, sugar triggers the same part of the brain, and in some cases, sugar has more of an effect on that brain than that part of the brain than heroin. Sugar today is so refined, it's so pure, that my belief, if sugar came on the market today in its current form, would be considered a drug. I mean, a drug that people you need a script for. It is a drug. I mean, the effects that sugar has in the body is just amazing. Not just with the part of the brain that stimulates the pleasure principle with heroin, but that's how addictive sugar can be, because you're getting that same effect that you're getting from heroin, and that's why people say, why can't I get off my junk food, or why do I always crave sweets, and why do I always go to the store and the first thing I go to is this aisle? And that's why, because the brain knows that if you eat this food, that you're going to be rewarded in a very similar way that you're going to be rewarded like taking heroin, and that's scary.
In my case, I'm actually fairly lucky because my wife, if you gave her a big bowl of ice cream or a big bowl of broccoli, she would take broccoli any day.
That's amazing.
She absolutely, there's nothing, there's very few things as far as vegetables she won't eat. There's one fruit that I know she will not eat, and I think she could be stranded on a tropical island filled with bananas. She'd rather starve.
They need a banana?
Yeah, they need a banana. There's something, she said, about bananas. Like, even if I'm eating one, she needs to just about leave the room. Just because the
Did she have a bad experience as a kid with the banana?
Know,
her mother or father made her eat bananas every single day?
I don't know, but she grew up, as a lot of us did here. She grew up poor, but she grew up very wealthy in the sense of, they raised their own food. They raised some of their meat. They cooked. They had their big gardens.
Yep.
And so this is what she's used to, and she absolutely. So in other words, it helped lead me, who I was spoiled before my time, as in, if we hear about, well, back when we were kids, if we had to eat what was put in front of us. Oh no, my mother was super mother, and if we didn't like something, she would have 3 different meals going at once. So I ended up being very finicky, but so was my mother. On the other hand, my father, who's probably watching this show, there's hardly anything. If he can catch it, he will eat it.
He will eat it.
As in, he's a connoisseur, but he's also very healthy. He's 80, I think 81. I know last year he pedaled his bicycle 1,000 miles.
Wow.
He's constantly on the go, and so he dances, and he dances it off, and he bikes it off.
Yeah, and we're finding out more and more just how important exercise is. Again, not just for building muscle tissue and other things, but just the endorphins and enkephalins that the exercise produces while you're exercising, but everything else about exercise. It helps with your digestion. Obviously, it helps with the cardiovascular system. It helps with your cognitive abilities. It helps control hormones. And one of the things we're finding out now in our society is that we're controlled a lot by our hormones in our body, and hormones again being insulin, cortisol, men testosterone, women estrogen, progesterone, and our hormones in our body are just, for all intents and purposes, are a mess now. If you test people and look at their hormonal levels, they're just all over the place. A lot of that has to do with diet, obviously, their nutritional status. Some has to do with stress. A lot has to do with exercise, not getting the right exercise to maintain, proper hormone balance. So there's so many different things that we have to look at in health today. Hormones are number one. Not number one, but are one. The inflammation in our body. We're loaded with inflammation in our body. And again, I don't mean little redness on your skin. I mean significant hormonal factors in our body, leukotrienes, prostaglandins, all these different things that again cause havoc, and we know now can lead to cancer. They need to be looked at. We're just looking at issues now with women in estrogen as they go through menopause, and the estrogen levels as it relates to different types of cancer, and how they can control that. Different things like your gut flora. Do you have the proper bacteria in your gut? And most people in this country have something called dysbiosis. They just have too much bad bacteria in their intestines, and the bad bacteria tend to basically produce more toxins, and the toxins get into the body, and again they cause all this inflammation and all these different things that are negative in our body. Sometimes in nutrition, when I'm working with someone, it's just looking to see, do they have the right amount of flora in their body and the right kind of flora in their body? Do they have the right digestive enzymes? As we age a little bit, our pancreas produces less and less digestive enzymes. So if you eat a particular food and people say, well, I eat right, I'm eating all the good things I should be eating, but your stomach or your pancreas may not be producing the enzymes to break down that food properly. And so it just goes right through you. You don't get the benefits, you don't get the nutrients from that food. And then the bad bacteria in the body pick it up. They start digesting the food, and they produce the toxins. So nutrition actually can start not only just what you put in your mouth, but follow it all the way through. And that's what we have to look at.
And there's even been a correlation now between, I believe it's poor dental care and heart disease.
Absolutely, there's a definite portal between like periodontal disease. When I was in Chicago, I worked at the University of Illinois, and one of the departments I did some research at was the Department of Oral Biology at the College of Dentistry. And there's definitely a correlation between poor oral health and not just heart disease, but other inflammatory processes going on in the body. Most well-known is heart disease, but we can look at other issues also with poor oral health. So you're right, that's something that has to be addressed too. So people think when they come to me, like, would you brush your teeth every day, or do you go get your teeth cleaned twice a year? I'm like, well, what does that have to do with losing 30 pounds? Well, if you have all that inflammation that's coming from poor oral hygiene, you're not going to lose weight with all that high inflammation, because that inflammation is going to tell your hunger hormones, leptin and ghrelin, to not work properly. One tells you not to eat, and one tells you to eat. So if those hormones, we talked about how important hormones are, just something like that can throw off your hunger hormones and your satiation hormones. When you're done eating, and people say, well, I just can't lose weight, and sometimes it's about oral health, without a doubt.
Now it's a little off that but I had this talk with my dentist, who's a great dentist, and we were talking about this. Why do insurance companies not cover things like oral health, other than, like, say, injuries, or then a lot of times they don't cover your eyes? And he said, basically, and it's a little exaggeration probably, he said anything from the chin up. He said your traditional insurance companies, unless you have some, rider or whatever you want to call on it, doesn't cover, because oral health care is expensive.
Absolutely.
But on the other hand, oral health care, it affects your health, but it also, when I was in legislature on the healthcare committee, sometimes it impacts your employability.
Right.
And so I've often wondered, like, how did that all come about with insurance companies?
That's a great question. I wish I knew the answer, but I don't. But you're right. I think if insurance companies are going to take care of the whole body, eye care, ear, oral health, all the different things, I think massage therapy has tremendous benefits in terms of draining the lymphatic system, which could lead to much healthier people. That should be covered. Acupuncture should be covered. There's a lot of alternative healthcare, not even all, but talk about dentists and other things. Right. I think should be part of traditional insurance programs, and I'm sure it's a cost-benefit ratio. I'm sure it all comes down to money, but that's just my opinion.
I've got to tell you a story. I think you'll appreciate this. My daughter-in-law is an RN, but she's also very open-minded. Well, my granddaughter had a extended period of time where her tear duct was blocked, and it kept draining past when her doctor thought it should be, and she's like, well, she's got to have surgery and that and everything, and but my daughter-in-law and my son said, that seems a little extreme. She suggested, she did some research and found this. They live in northern Maine, and they found this DO in Portland, who was very well known. And the doctor just basically rolled her eyes and said, I don't recommend anybody goes to something like that. But on the other hand, they did the research, and they said, well, we're going to go, and we're going to see what she has to say. And 3 appointments later of manipulating, nothing invasive, nothing that would do any harm. No operation, no anesthesia.
Oh, yeah.
And she's cured.
Yeah.
And I haven't heard what the doctor had to say, because probably the doctor would say, well, she just grew out of it.
Yeah.
But yeah, so they've had a very good experience.
Yeah, and getting back to the chiropractic part of my practice, it's amazing just what chiropractic can do. And again, I'm very lucky because I've developed, I think, a pretty good relationship with most of the MDs in this area, and they don't have a problem referring to me, or if their patient goes to them and says, I want to see Dr. Harris for this, and I'll say, yeah, try it, and let's see how it works. And a lot of times, whether it's headaches or neck issues, mid-back, arm pain, low back pain, sciatica, sometimes hiatal hernias, some of the other things can definitely be worked through manipulation. Now, I'll also be the first that if someone comes in and we're just not getting them better, I'm just not getting them better, and say 3 to 4 visits, I'm not going to have them keep coming back and coming back and coming back. I'll refer them to the hospital. I'll get an X-ray, and if they're at the point where I think they need a surgical consult, I'll send them out right away to try to get a surgical consult. The problem is that a lot of times they're in such extreme pain. and I want them to see either an orthopedic surgeon or a neurosurgeon, and sometimes it's a 2-month wait. Well, what are they going to do in the meantime before they get in to see this person? If they need surgery and they're in pain now because the wait is so long, and that's something that has to be addressed also. There has to be something in the middle between me, where I'm probably not going to be able to help them because they have stenosis or they have really bad herniated discs, and something before they can get to a consultation for a neurosurgeon. That I'm finding frustrating here. That sometimes there's the gap between that is just way too long.
And I think we're running into that with a number of things just because of the shortage of doctors. And this isn't the shortage in the diversity of doctors isn't rare for rural America, as rural America has a it's a challenge. You like living here, but you're coming from Chicago. Well,
right.
You had the world at your fingertips there.
Almost every block.
And so some people can adjust to this way of life.
Yeah.
Other people, it drives them batty.
Right.
But it takes the right kind of person to want to live here.
It definitely does, and as you referred to, that may be part of the problem why there's so many docs who come here and end up leaving within a year or two. They just can't adjust to this lifestyle, and it's not an easy lifestyle. Let's face it. I mean, it's rural, it's cold. To try to get to anything, it's a good hour drive to try to get to some type of a store. Thank God we have North Country here. That's right up the street. People live a little bit farther away. There's Copley and always Dartmouth is close also. But it's still very, very difficult. It's a challenge without a doubt.
Well, and it's like I remember when I first met Dr. Lockridge, I asked him. I said, what brought you here? He's a Yale-trained oncologist and internalist, and he could find a job anywhere. And he says, skiing. But he's actually a snowboarder. Yeah. But in all seriousness, Jay Peak and Burke now, because they're becoming real renowned ski areas,
right.
They are attracting different people to visit here. And there's some people who, such as Dr. Lockridge, he's driven to snowboard and he wants to live here,
right.
And he's willing to pass up the pay to live here. And I think we might be, I think as we develop, as long as we don't want to develop too much to make it not the kingdom
right.
But I think there's more opportunity to be attracted more people.
Oh, without a doubt. It's funny. Les and I had a talk a couple of weeks ago when one of my office visits with him, because as you said, I'm from Chicago for 30 years, and he did some of his postdoc work in Chicago. And we were talking about, could you ever go back to the city again? And he said, absolutely not. He just could not wait to get out of Chicago and get to a place like this. So yeah, he's very, very happy here. Every once in a while, I still get a little bit of a city fix. I'm not quite 100%, totally immerse myself into the country rural lifestyle. But maybe every 6 to 8 weeks, I'll go to Montreal for a weekend just to get my city fix. And then after that, I'm like, okay, now I know why I don't live in the city again. So
now I'm a country boy, but I love to visit a city. I find beauty in the Northeast Kingdom, but I also find beauty in a city. Now, in that being said, I'm not sure if Nashville is considered a real city. It's quite sizable. I just came back from Nashville after a week, and if you ever decide to set up a satellite shop anywhere, office, wow, Nashville needs you. I am a healthy eater, as I said. Trying to find something not soaked in butter or grease was amazingly hard. So I think they could use some of your nutrition.
They probably could, and I think we were talking about before the show that I think Alabama and Mississippi have the worst obesity rates in the country, and the South tends to be much worse than most parts of the U.S. But in all honesty, trying to get someone to change their lifestyle to make the changes that they need that would be beneficial for them. So if someone comes to me and I say, okay, you need to give up coffee for a couple weeks, We need to get you off your high sugar diet for a couple weeks. We need to, increase your cruciferous vegetables, or we need to do this, or we need to do that. A lot of people are just so resistant to making major changes in their lifestyle, even though they may be walking in with a referral from, let's say, someone who has cancer or diabetes or heart disease or irritable bowel or Crohn's disease or something, and you can help them with this in terms of working through and not just treating the symptoms, not just kind of giving them something and say, okay, this will make you feel better, but what's the cause of the problem? What is actually, and this is what we need to do to kind of dig deeper, dig under that iceberg, because most of the iceberg is underwater, and we have to find out what's going on there. But the resistance for a lot of people to try to make those lifestyle changes is very, very challenging. Right. In all honesty.
See, I personally could not have done it, without my wife. So we had at least a leg up, because she just loves vegetables. So I will never get a craving to have a bowl of broccoli. I will assure you of that.
I won't either, believe me.
But I can now, at least that junk food aisle doesn't call my name, and I'm able to eat broccoli.
Yep.
But I still won't get fixated on. Hey, we have to be wrapping up here pretty soon. But before the show, you and one of the employees here were talking about BMI, and you actually agreed on it. Is BMI really isn't a good indicator? And what is BMI?
Body mass index. I think BMI is a very archaic way of measuring someone to see if they're actually overweight or obese. I think it came out of the insurance charts way back in probably the 60s. And so basically you look at how tall someone is, and how much that they weigh, and then you do a calculation, you come up with a number. All right, could be 25, 30, and but let's just say behind the cameras we have two people, okay? We have someone who's, let's say they're both 6 feet tall, and the person on the left over here weighs 300 pounds, and the person on the right over here weighs 300 pounds, okay? BMI exactly the same, right? Both 6 feet tall, both 300 pounds. BMI would come out to probably 31 pounds, 31, which would be clinically obese. Well, what if the person on the left is a linebacker for the New England Patriots, and his body fat is actually 12%, and the person on the right, body fat is 50%. It tells you nothing about the health of the person. So they both have the same BMI, and an insurance company will look at them and say, gee, your BMI is 31 because your height to weight is this, but he's 12% or she is 12% body fat. That's an incredibly healthy way to live. And so BMI, in my opinion, should be thrown out. And it should be based on really just percent of body fat. How much fat do you have compared to muscle tissue? And because the NIH years ago came out with the number one factor for determining long-term life or morbidity or mortality issues is your percentage of lean body mass. So the more lean tissue you have on you, technically you're going to not only live longer, but you're going to live a lot longer and a lot healthier. Right?
And thin does not necessarily mean healthy.
Not
either.
At all. There's a term called skinny fat. And unfortunately, this tends to be more true for women because women tend to yo-yo diet. So again, they lose 30 pounds of muscle tissue, then they gain 40 pounds, and they gain it all fat back again. Now the metabolism is slower. Then they go back down and they lose their 30, 40 pounds again, and they look nice, but they don't have any muscle tissue on them. It's all fat tissue. Even though they're skinny, they don't have a whole lot of muscle tissue. And there's a term called skinny fat. And I have people come into my office all the time, and they're thin, and we'll measure their body fat by electrical impedance, and they're 38% body fat, even though they look very, very thin. And 38% body fat would be considered obese.
I know we have another mutual acquaintance, Lynn Tangway, who's a personal fitness trainer, and she tries to incorporate, nutrition into exercise because, nutrition's great, but, a good dose of exercise is also very beneficial.
You have to. You have to exercise properly. You have to eat properly. You still have to look at the stress levels, because stress will put fat on you. There's too many studies out there that show that people who are under, especially women who are under more stress, tend to put on more body fat. But you're right, we have some great personal trainers here. Lynn is phenomenal. Sharon Stewart is a great personal trainer. We're very, very lucky to have a couple personal trainers that are dedicated to their clients, and they're extremely knowledgeable in what they do, without a doubt.
We are very fortunate, and although sometimes the news doesn't document what I say, and I'm probably wrong, but I still think we're starting to catch on. I do. I think we have, and I think one thing we've caught on to, at least most of us, is personal responsibility too. Mm-hmm. And if we're going to wait for, maybe there will be a magic pill that will evaporate fat, but that still won't make us healthy.
It won't do anything with the muscle tissue, won't do anything with the stress, won't do anything with a lot of other things, won't do anything with the hormones. So yes, there's a lot of other things. Yes, we could lose the fat, but there's still other factors, and that's why massage therapists, personal trainers, acupuncturists can still benefit someone a lot, other than just losing 10, 20 pounds of fat.
So I have noticed in just the last few years, particularly in the last couple years, is that the healthcare community is getting, it's always been here, but I think it's becoming more cohesive now. And I think, as I said, go back to, I think these are changing times in so many ways in healthcare, whether it's healthcare funding, whether it's doctor shortage. I think now it's becoming even a bigger family.
Yeah.
And I think it's really going to help, because I don't think you have all the answers, as
Absolutely
Dr. Lockridge doesn't have the answer, or neither does even, I think Dr. Wood, my doctor, has all the answer. He assures me he is not God, but yeah, he's pretty close.
He's pretty up there, huh?
Yeah,
No,
in my mind.
No, I agree. Like I said, when I first came here, I was a little worried about the cooperation between alternative and traditional healthcare. But in the year that I've opened up, it's been wonderful. People, not only the community, but the community of standard healthcare practitioners have given me a lot of compliments, and have sent me a lot of patients, and I send them a lot of patients. So I think that integrative approach to everyone kind of using each other's expertise has come a long way, and it has to continue to grow, because ultimately what's best for the patient.
Right.
I can do something that I think is best for the patient, but they may need someone else who can give them this, which I can't, and they may need someone else who can give them this that the two of us can. And so it has to be an integrative approach, and everyone has to be open to making that happen.
Now, on a little humorous note, I think of one of the first naturalists or who used her environment to treat people was Granny Clampett.
Granny Clampett.
And you remember, if you
we're definitely showing our age on that one.
She had stump water, and she had all kinds of natural ingredients. Yeah. Of course, I kind of liked her arthritis medicine there.
Yeah, that was what, little moonshine, I think?
Yeah, little moonshine. It's kind of like on the Waltons.
Yep.
Remember the Baldwin sisters?
What they call that, the recipe?
The recipe.
Yeah.
And that was, again, moonshine.
Absolutely.
So do you ever prescribe moonshine for people's ills?
I can't. I can't tell someone to go out and have a good stiff drink, but research has shown that alcohol in moderation, a glass of wine with the resveratrol, and maybe 4 or 5 ounces of more of a harder liquor, does have good beneficial effects, as long as you're not at a bar and driving home. There are definitely medicinal purposes or results that do come from certain alcohols. So I would I, if I could, tell people to have a little drink now and then? Absolutely, including myself.
I've asked Dr. Wood, I said, hey, I see a study that if you have 2 beers a day, that's actually good for you. I said, does that mean I can reserve those 2 drinks a day throughout the week and have it all at one sitting?
I hope he said no.
No, he said,
Okay,
yeah,
good.
he did say no.
All right,
It does
good.
not work that way.
No, like I said, a couple small glasses of wine with the resveratrol daily is fine, and as long as you spread it out. Because again, you don't want to overload the liver where the liver can't detoxify the alcohol, and then you're actually causing liver damage because you have way too much, ethyl alcohol going through your liver, and now you're damaging it because it's just too much. A little bit in moderation is absolutely fine.
Okay, in closing, how can somebody contact you if they want to meet with you?
Well, the number has stayed the same, so it's 334-3000, and that's probably the easiest way to contact me. I'm still waiting for my phone service to be hooked up, but everything is being transferred to my cell phone now.
Right.
So I'm still getting calls through there. But again, it's at the wellness center, so you can drop by there.
Where is the entrance to it?
Right in front, as
Right
you
in front. You're
walk
in
in.
front.
As you walk in, as you drive in, it's the only door
Right.
facing you, and I'm having some signs made now, and hopefully they'll be up either this week or next weekend. You'll be able to
Because
see
I know
it.
there's, like, when I go to the wellness center and my morning workouts, we go on the side, and I think there's another one. So that's how come I wanted to define
Yep.
where you actually.
Yep, right in front of the building.
So, okay. Any more words for the viewers?
No, I think we've covered everything. I just appreciate you having me back a second time. Hopefully I haven't bored anyone like I did the first time.
Oh,
Hopefully
no, you
people will get, if I go to a lecture or a conference, I always say if I can take a couple things from that seminar and utilize it in my life or my professional life or my family life, then I consider it a success. So I hope people can get at least a couple things from this that they can actually utilize in their personal life.
Okay, and I also wish you well in your battle with leukemia.
Optimism.
Goes a long ways.
It goes a long way. You have to be positive with everything that's going on. And I have a great doc, and using again the other parts that I think are appropriate with it, and I'm sure everything will be fine.
I interview people who are super old that make us look really young in their 90s, and they also said it's optimism, but also a sense of humor. No matter what comes your way, you got to find a bit of humor in life.
I agree.
So,
I agree. Scott, thank you very much.
Thanks for coming on.
I appreciate it.
And thank you to the viewers for tuning in to another segment of the Northeast Kingdom Voice.